Some of the most common questions that I get from parents of infants are about flat spots or cranial shape. Does it look like they need a helmet? Will it get better on its own? We try tummy time, but they don't seem to like it. Is that enough? Is it going to stay this way? Well, with most parents having these questions, even if they haven't asked them out loud to a practitioner, the topic of plagiocephaly needs to be addressed. What are the causes, and how can we get help before it's too late? Unfortunately, for most parents, helmets tend to be the only option that they get offered for plagiocephaly by traditional medical doctors and specialists. However, this approach does not get to the root cause of the problem, nor help with any mobility challenges. We will answer your questions about it all. What is plagiocephaly? What causes it? And is the helmet the only way to care for or treat it? What are some more natural or effective and gentle ways to care for a child struggling with it? Let me tell you a story about Millie. As Millie got older, her parents became increasingly concerned as they watched the flat spot on her head get worse and worse. Her pediatrician suggested a helmet, but Millie also faced movement restrictions with her neck and jaw, and they knew the helmet would do nothing to help with those challenges. Mom and Dad tried to keep Millie off her back as much as possible, but thank goodness they listened to their gut instinct that kept telling them that there was something more going on here, and there had to be a root cause of her plagiocephaly. So what are the three main causes of plagiocephaly? First is pressure from positioning while sleeping or even in the womb. So plagiocephaly is caused by repeated pressure on one part of the baby's skull and is made worse when babies lie or sleep in the same position most of the time. This is common occurrence in infants, and studies show that 20 to 25% of babies develop varying degrees of plagiocephaly when they sleep on their backs. Plagiocephaly can even start to develop when babies are in the womb. If they're stuck in an abnormal position and their head is tightly pressed against the uterus, then they can develop this spot already. This risk is higher with twins or multiples who have even less room inside the womb. The second thing is muscular torticollis causes a stiff and stuck twisted neck that limits their movement. Plagiocephaly can also be talked about alongside muscular torticollis, which is a condition in an infant that causes a stiff, stuck, and twisted neck, where the child's head is continually bent to one side, making it difficult to turn and rotate their head and neck in both directions. Because the neuromuscular tension and restricted movement caused by torticollis, it often causes or contributes to plagiocephaly in a big way. And many children struggle with both conditions simultaneously. And the third thing is that birth interventions, including forceps, vacuum, and C-section, this birth intervention, such as forceps vacuum during delivery, has been associated with an increased incidence of head shape abnormalities, including plagiocephaly in infants. Several studies have investigated the relationship between birth intervention and the incidence of plagiocephaly. A systematic review and meta-analysis published in the Journal of Pediatric Rehabilitation Medicine in 2018 found that the use of forceps or vacuum during delivery was associated with a significantly increased risk of plagiocephaly. So what are some of the signs that your baby may be struggling with plagiocephaly? Some symptoms of plagiocephaly are pretty straightforward and can be included in the following. A visible flat spot on the side of the baby's head or the whole back side of the head. The baby usually has less hair on the flat side of the head, and when looking down at the baby's head, the ear on the flattened side may look pushed forward. There's an imbalance of the ears, the eyes, or other facial features, and in severe cases, the forehead might bulge on the opposite side of the flat head, along with other facial asymmetries. Plagiocephaly itself shouldn't be painful for babies. The risk is that they'll struggle to hit their developmental milestones due to the underlying issues with gross motor function, subluxation, torticollis, and so forth. It can also really affect how their eyes can see, which can make doing those gross motor functions more difficult for them. And there's a study that we will link here, and it will be on our Instagram, that shows that those delays could carry on into the toddler years. Additionally, kids with unresolved plagiocephaly could be more susceptible to ear infections and other respiratory infections, since the subluxations and motor restrictions limit the body's ability to drain fluid from the ears and move mucus through the respiratory and lymphatic systems. If we have a shift in how the head is sitting, then it changes the way that the ear canals move, and it will affect how they're draining. So, what are some natural and less invasive options that are available to children with plagiocephaly? Thankfully, today, many parents do just as you are right now, exploring other options for plagiocephaly besides traditional medical recommendations of helmet therapy, physical therapy, and so forth. We strongly encourage you to keep looking beyond those options until you find one that truly gets to the root cause. The treatment of plagiocephaly should never require medication or surgical intervention, since the vast majority of cases do not involve a condition called craniosynostosis. That would be where those joints in the skull are fused together and cannot move. Millie's parents were not shocked when they saw that Millie's neurological insight scans clearly showed one side of her neck was more stressed and subluxated because of her limited movement. The significant subluxation shown by the red bar on this neurothermal scan image is the most common pattern that we see with plagiocephaly and torticollis cases. In addition to consistent chiropractic adjustments, we encourage ways to support your baby at home, as well as with the following home care options. Be sure to allow for plenty of tummy time and multiple positional changes. Try to limit the time that your baby spends in bouncers, swings, car seats, anything where they're stuck in one position for a long period of time. And then alternate the side that you hold your baby when feeding and carrying. It can also be something that we can induce with our movements, not just theirs. Once Millie started chiropractic care, her parents began to notice improvements immediately. Millie shocked her pediatrician by only having to wear her helmet for a very short period of time. The chiropractic adjustments got her nervous system to a healthier place and cleared out those subluxations so her neck and jaw could move easily and her skull could continue to grow and mold properly. Millie gained an extra benefit or positive side effect of chiropractic care, including consistent bowel movements and overall happiness. And as I mentioned before, so many parents have had these questions, and we're happy to answer them for you. Our DMs are always open. For more resources, visit the link in our bio.